Hello and welcome once again to Moorgate Andrology. And in today's video I want to talk about how to increase your penis length. You know, Moorgate Andrology, we get a lot of guys, hundreds of guys actually, calling us to say, how can I increase penis length? Guys want to make it longer, their penis longer, to increase their self-confidence. And thankfully there is a way to do this. It's a minor surgical procedure and it's called ligamentosis surgery. Ligamentosis surgery. Excuse me. And it's called ligamentosis because it involves surgery on a ligament, specifically a ligament called a suspensory ligament. And this is a ligament whose only function in the human body is to keep the penis upright when it's erect. What happens during this surgery is that the urologist will divide the midline of this ligament. He'll cut it and leave the lateral parts intact so that your penis still stays upright when it's erect. But by dividing this ligament, it releases hidden length, extra length that we all already have, and this increases the flaccid size of your penis. It slides the penis forward. This action slides the penis forward and reveals this hidden length. Now, the results of this surgery are quite predictable. 95% of men will achieve an extra 1 to 2 inches more in the flaccid state of the penis. 5% will either get a bit less than 1 inch or a bit more than 2 inches, but for most the results are very predictable. So, for example, if you are a bit embarrassed about the length of your penis when it's flaccid, perhaps for example, if you're changing at the gym or changing at football with your mates, and you're lacking that self-confidence in your size, this can be a really useful surgery to give you a confidence boost. Now, the surgery takes about 1 hour and it's done under general anaesthetic. So you're asleep when you have it done. And in nearly all cases, you can go home on the same day. Depending on the type of work you do, you'll need to take maybe 2 to 3 days off if you have a sedentary job, maybe up to a week if it's a little bit more physical. In the little cut that's made at the base of the pubic area to access this ligament, you will have some dissolvable sutures. They drop out on their own over the following weeks. Now, when you've had ligamentosis surgery done, you should see the results immediately. The extra length is there. Usually before the surgery, the urologist will take some photographs and also some preoperative measurements, so they can be compared to around 6 weeks later when everything's settled down. He'll take some more photographs and some more measurements at that time. Now, the healing process is fairly straightforward. You won't be able to have sexual intercourse for 6 weeks. It needs time to settle down, for everything to heal. You will have a course of antibiotics for a week, then the hospital will give you some pain relief if you're a little bit sore in the first week after the surgery. So no sex for 6 weeks, and it's also helpful if you don't go to the gym for a similar amount of time, about 4 to 6 weeks later, just giving everything time to settle down. So that's ligamentosis surgery. It's a way that you can increase the length of your penis. Now, after the 6-week period is over, most urologists like you to use a traction device. This is a device that you fit onto the penis and you wear maybe for an hour or two in the evenings over the course of the following 9 to 12 months. Because this does two things. It keeps everything the penis nice and stretched in the first weeks after the surgery. It helps prevent reattachment of the two ends of the ligament that were cut. And also it can increase the erect length of your penis over the course of the following year by up to 1 inch. So in urology speak, we start by increasing the flaccid length with ligamentosis surgery, and then we move on to increasing the erect length with the extender. Now, one of the questions that most guys ask when they're looking to have ligamentosis surgery is the surgery permanent? Well, the answer is yes, it is, because now we put something called a silicone buffer in the space that's created when the two ligaments were cut. And this helps to stop the ligaments from reattaching. We don't want that to happen, because if it does, the penis will pull back to where it was, or even a bit shorter. So we want to prevent that. And by putting in this silicone buffer, then that will prevent that. So ligamentosis surgery is permanent. You will not need to have that performed again. Now, quite often, penis lengthening surgery is combined with girth enhancement, a fat transfer to increase the penis girth. We'll do another video about that some other time, but I just wanted to mention that in most cases, actually, guys who have lengthening surgery will also go for the girth enhancement surgery at the same time. So that's all from me today on penis lengthening surgery or ligamentosis surgery. I hope that's giving you some insight about how you can increase your penis length. So until next time, that's all from me today. I look forward to seeing you back here at Moorgate Andrology very soon. You can find out a lot more about penis enlargement surgery generally by visiting our website at www.moorgateandrology.co.uk. And of course, if you subscribe to the channel, you'll see many more videos on various aspects of penis enlargement. Thanks for watching. I'll see you next time. Bye for now.